Today on Investigate TV Plus, the price of birth.
I just remember leaving the hospital like, whoa.
Bringing a baby into the world can be an exciting time, but it can also be one of the most expensive.
Even with health insurance, the out-of-pocket costs for pregnancy and childbirth can be upwards of $2,800.
We take an in-depth look at the financial burden of giving birth and speak to lawmakers from both sides of the aisle about a potential common ground solution.
Then,
not great that he's there, but at least he's somewhere I know where he is and he'll get medicated properly.
following his arrest, a mother thought jail would protect her mentally ill son from himself in dangerously cold weather. But after he spent 8 days in a county lockup,
what was that like, hearing that he essentially froze to death?
Unbelievable. Like, I feel like I'm in a hell episode of The Twilight Zone.
we investigate his cause of death. Plus,
he bangs a lot, he yells a lot, and he paces a lot.
examine security video of this man's detainment.
And we reveal a birthday present rooted in one woman's decades of volunteer work.
Oh, I was absolutely blown away. You can't imagine. I cried all afternoon.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. It's a bold proposal, a bipartisan push to make childbirth free in the U.S. I'm Lee Zurich.
And I'm Tisha Powell. If you've had a baby or you're planning to, you may already know how expensive it can be. One recent analysis found cost for pregnancy, childbirth, and postpartum care total, on average, more than $20,000. That includes nearly $3,000 in out-of-pocket expenses, even with health insurance.
Reporter Heather Graff breaks down the financial burden and shows you why some lawmakers say it's just too much for American families.
Hi, Zion.
A quiet moment with her youngest. Or playtime with the big kids.
This is the game.
All of it for Isis Finley
Good job.
is special.
I love you.
Oh, I'll take that. Being a mother like completely changes you because you, from that very first kid, you just don't think about yourself.
And have you always wanted to be a mom?
Yes.
Now a mother of 5, Finley says she knew raising a child would be expensive. What she didn't account for is how much it would cost just to give birth.
Probably like $6,000 or $7,000 after insurance covered it. And I just remember leaving the hospital like, whoa. Not only are you trying to figure out how to be a mom, but then you have this added stress of, okay, I don't want to be in debt.
So she's not surprised by research that found new moms are twice as likely to have medical debt as young women who did not recently give birth. Finley recalls setting up a payment plan for those out-of-pocket expenses when she had 2 of her kids with private health insurance, and then a vastly different experience with her other 3 children because at that time she was enrolled in Medicaid. The government-funded program provides health coverage to low-income families, and thus, Finley says her labor and delivery costs for those pregnancies were fully covered.
I think it's outrageous.
Does it speak to the system being broken?
Oh, yes.
The healthcare system?
The health, absolutely.
Search the phrase birth bill or baby bill on social media and you'll find plenty of other parents who feel the same way.
So the total cost to have a vaginal birth with an epidural with insurance in America is $22,346.
This new mom out of Utah sharing screenshots of each invoice and the amount she's now on the hook for after insurance.
$7,411.84.
The costs are staggering, and this has been a problem for years and years.
Erin Mackay is with the nonprofit National Partnership for Women and Families and says the big bills associated with pregnancy and childbirth can also have an impact on maternal outcomes, citing instances where women have delayed or skipped prenatal and postpartum care because they simply can't afford it.
Maybe it's for the prenatal vitamins. Those costs can really add up when you're pregnant. The ability to go see a mental health provider, to be able to check in with a nurse or a doctor on complications in the year after childbirth is incredibly important.
Her organization and several others have endorsed a new bipartisan effort on Capitol Hill. The Supporting Healthy Moms and Babies Act aims to make childbirth and related maternity services free for families. If approved, it would prevent cost-sharing requirements for prenatal, childbirth, neonatal, perinatal, and postpartum health care by designating those services as essential health benefits and requiring private insurers to cover them the same way that Medicaid does.
It puts mothers in a position where they can focus on their care and the care of their baby without having to worry about how they're going to pay for it.
Democratic Congresswoman Jennifer McClellan and Republican Senator Josh Hawley among the coalition of lawmakers who co-sponsored this legislation.
They would say, nope, insurance companies can't do it. You can't charge all those out-of-pocket fees. And it would help families. It would give them a leg up, give them something to stand on when they're trying to get their family started.
Meanwhile, according to the CDC, birth and fertility rates in the U.S. have been largely on the decline. The nation's GFR, or general fertility rate, dropped 22% from 2007 to 2024. And as that issue has gotten a lot of recent attention from the Trump administration, some Republicans have suggested this free childbirth bill could be part of the solution for that too. Senator Hawley, though, stopping short of making that connection.
Do you think this legislation reducing childbirth costs could also help address declining birth rates?
You know, I don't know the answer to that. I mean, it'll be up to families to make their own decisions.
We also asked experts at the Population Reference Bureau for their insight.
It would be unlikely to have a real measurable impact on the actual birth rate.
As someone who studies population data, PRB President Jennifer Shuba says the financial decisions of starting a family are not that simple.
The costs associated with having children, they don't begin and end just with birth.
Okay, throw it to Sage.
A challenge that Isis Finley says many moms and dads deal with every day.
Now childcare, what am I going to do for that? Can I afford formula or diapers? Like, it's much more than that, and I think that's why birth rates are low.
Now you gotta open it.
Yet as she reflects on her own path to motherhood, Finley says she does support the current push to make childbirth free, and she hopes it will help moms and babies.
Hi, little boy.
Be healthier and happier from day one.
They should not have to think about, like thousands and thousands of dollars after the baby comes. So I think this bill will help mothers significantly with just avoiding that stress.
Now, if this legislation is approved and makes childbirth free for people with private insurance, one big question is whether insurers will then pass those costs on to all plan participants by raising premiums. The Niskanen Center think tank analyzed this proposal and concluded it would likely lead to a modest increase, but called it a worthwhile trade-off. Meanwhile, America's Health Insurance Plans, or AHIP, which is a trade association representing the health insurance industry, has said coverage mandates do tend to raise health insurance premiums. You can read the organization's full statement on InvestigateTV.com.
Still ahead, a mother alleges jail staff ignored her son, who she says was suffering from a mental health crisis.
How do you treat somebody like that? Just leave them in a cell on the floor, naked, when it's freezing.
Then, just over a week after his arrest, he was found dead inside his cell. We investigate this man's detainment and show what security video reveals.
A grieving mother wants accountability after she says her mentally ill son froze to death while in the custody of a Georgia jail.
On December 18, 2022, Anthony Lamar Walker was arrested on a charge of aggravated assault. 8 days later, Walker was found dead in his cell. The medical examiner determined the cause of death was hypothermia.
Hypothermia occurs when someone is exposed to cold, wet, or windy conditions and their core body temperature drops below 95 degrees. The condition can affect the brain, making the victim unable to think clearly or move well. A federal lawsuit alleges deputies knew Walker was cold and were aware of his mental condition, but failed to protect him.
Investigative reporter Andy Parati takes an in-depth look at the case.
From the moment Anthony Lamar Walker arrived at the DeKalb County Detention Center in 2022,
his behaviors were very erratic over the last few days.
jail staff sensed something was off.
He bangs a lot, he yells a lot, and he paces a lot.
The 34-year-old wasn't eating. He urinated on his clothes and threw his food tray. His mom, Tony, says her son battled schizophrenia and believes he was going through a mental health crisis. According to his medical records, the jail knew he suffered from mental illness. It treated him before. Detained this time for alleged aggravated assault.
So I figured, okay, great. Not great that he's there, but at least he's somewhere I know where he is and he'll get medicated properly.
8 days after taking him into custody, deputies found Lamar unconscious. Jail records show medical staff didn't perform CPR.
He made contact with EMS and have EMS en route to the DeKalb County Jail, reference to a possible deceased male inmate.
According to the DeKalb County Medical Examiner's Office, Lamar didn't die from physical trauma, an overdose, or by suicide. His cause of death, hypothermia. Found with no clothes on and cold to the touch the day after Christmas. What was that like, hearing that he essentially froze to death?
Unbelievable. Like, I feel like I'm in a hell episode of The Twilight Zone. You let a person freeze to death? No one did their job.
Stay inside, stay warm if you can. This is pretty historic December cold for us.
Days before Lamar was found dead, jail staff sent this email reminding employees to prepare for the cold weather and to give inmates 2 blankets each.
And it was like really, it was cold, like really cold, because like sometimes even when I would walk through, I would have my, my jacket because it was like really cold.
And it'll feel like 5 below, so absolutely layer up as much as you can.
According to a wrongful death lawsuit filed in federal court, it claims the sheriff's office and medical staff failed to protect him, alleging Lamar received no medication, no mental health screenings, and did not adequately check on his well-being. This nurse claims she checked on Lamar around 7 a.m. hours before he was found dead.
And we had a small conversation. I asked him, I think I asked him what have he been eating. And I said, put some clothes on.
According to the security video, that didn't happen. Watch closely. The nurse walks inside the jail pod shortly after 7 a.m., but never checked inside Lamar's cell before walking away.
And they did nothing. Like, how do you treat somebody like that? Just leave them in a cell on the floor, naked, when it's freezing. All you gotta do is open the door.
Tony knows the cell where her son died well. She was a DeKalb County deputy at the same jail for nearly 23 years, once awarded the Employee of the Month.
I used to be very proud of the fact that I worked there, but now I'm embarrassed, I'm upset, I'm hurt, I'm deeply hurt.
DeKalb County Sheriff Melanie Maddox declined interview requests to discuss Lamar's case, and in an investigation by the sheriff's staff, found jail employees did not violate any policies.
Which is a real slap in the face.
Tony disagrees, and she wants to hold the sheriff's office responsible for her son's death.
So you telling me you saw no wrong with that when you didn't even do your job?
We've reached out to Sheriff Maddox, but she has refused to comment.
According to court documents, Sheriff Maddox has asked the judge to throw out the lawsuit, arguing that under the Georgia state constitution, she is protected by sovereign immunity, a legal doctrine which protects the government from being sued.
Up next, it's one of the leading causes of death in the United States and one of the hardest to detect.
It's like finding a needle in a haystack, and that's where AI comes in.
We examine an emerging revolution in the diagnosis of lung cancer and provide insight into how it could improve patient care and outcomes.
From preventative screenings to treatments, some doctors say artificial intelligence is revolutionizing healthcare.
In a survey by the American Medical Association, 66% of doctors report they currently use AI in their practice for tasks including billing, codes, medical charts, or visit notes. Experts say AI's growing role in healthcare should be seen as an opportunity.
It's saving them time, it's giving better quality care for their patients. They're having more time to do other things. So I feel like this is something that doctors should be excited about.
Beyond time saving, AI could soon be life-saving for some patients.
Reporter Jen Pachano examines how artificial intelligence could give doctors an edge in diagnosing lung cancer.
We needed a way to find a lung cancer early. It's like finding a needle in a haystack, and that's where AI comes in.
Lung cancer nodules in their early stages can be nearly impossible for radiologists to see. Usually, lung cancer goes undiagnosed until patients start feeling symptoms.
When they are having cough, chest pain, or blood coming out of the sputum, unfortunately, that stage is stage 3 or 4. And at that time, the survival rate is whatever you do is in single digits.
Radiologist Dr. Amit Gupta and his team at university hospitals are now conducting a study using AI to see if they can get to it sooner.
In my initial experience, it can find some of the nodules which are super hidden. And on a busy day, even a trained cardiothoracic radiologist may overlook them.
Cure AI acts as another set of eyes in the room for radiologists. Dr. Samir Shah, the chief medical officer, says its AI algorithm was trained on large amounts of data gathered over 9 years studying tuberculosis x-rays.
Those x-rays could be used not only to look at TB, but we started looking at lung nodules as well. And we looked at 5 million of those. That's more than I would ever read, and maybe tenfold more than I would ever read in my entire lifetime.
Through this vast amount of data, it learned what was and what wasn't a nodule. Dr. Shah says they're hopeful this application could result in a stage shift, catching lung cancer in stage 1 or 2 and boosting survival rates to 60 or 70%.
When it starts small and has not spread and it can be removed, you're talking about a curative situation, which makes patients happy, but that's what the goal is for every oncologist. That's what the goal is for every thoracic surgeon who's involved, every pulmonologist. That's what the aim is.
Cure AI tackled lung cancer first because of the difficulty of detection, but they say this technology is also incredibly positive for diagnosing other equally complicated illnesses like breast cancer.
Up next, an honor that could make some green with envy. We reveal the inspiration behind one woman's surprise of a lifetime.
It's a unique living legacy which will continue to grow for decades to come.
For her 95th birthday, the University of Vermont's Pringle Herbarium wanted to do something special for longtime volunteer Hilda Wright.
The story of her gift begins in 2023 when a university researcher discovered an unusual fern during a trip to Colombia. He eventually chose to name it after Hilda.
Reporter Joe Carroll introduces us to the inspiration behind the name.
Dried plants.
At the University of Vermont, 95-year-old Hilda White plants herself down to a unique job.
Well, we have lots of green.
For 28 years, she's been volunteering at the Pringle Herbarium.
Some of the plants are beautiful.
It's kind of a library for plants.
I can't draw, but this is my artistic outlet.
She mounts species from all over the world,
I mounted that, but I did not collect it.
preserving them for future generations to see and research.
If I mount the plants will be around for hundreds of years, barring any unforeseen accidents or anything.
In 2017, the plant collection almost went up in flames. At the time, housed here at Torrey Hall, Hilda was coming into work.
Wow. You can't imagine what that felt like.
Wes Testo, now the director of the collection, was in South America doing research.
And all I could see was from an email in Colombia, the roof on fire. I thought my whole PhD was going to go up in flames along with the rest of the collection here.
Hilda, staff, and other volunteers restored and remounted the damaged plants. The collection is now at the Jeffords Building.
So there will be 400,000 plant specimens in this one room.
Hilda mounted a huge amount of the specimens that you see here.
For that reason, Hilda received a surprise of a lifetime for her 95th birthday.
Nobody else gets a birthday present like that. It looks like my mount.
Yeah, good. A Christmas fern that Wes discovered in Colombia in 2023.
And I was walking through a forest there, saw this just spectacular fern. I knew immediately that it was something I hadn't seen before.
We're going to name it after you, Hilda.
Oh.
So it's going to be Polisticum hildae.
Oh my gosh. Oh my gosh.
The never-before documented plant discovered by Wes will forever be called Polisticum hildae.
Oh, I was absolutely blown away. You can't imagine. I cried all afternoon.
Her contributions here are absolutely essential to the research that we do here.
And I have to make sure I get it mounted the right side up.
Hilda's prepared 50,000 specimens, with more to come.
Oh, no. I'll be here as long as I can.
What are you going to get him for his birthday? A relationship seated in a common goal.
He just got good wishes.
I could say a lot after watching that story, but she's 95. She looks incredible. She is sharp, great personality. I love it.
Yeah, and all the work that she's put in there, and they're going to remember her for years to come.
Yes, they will. That's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching.
On the next Investigate TV Plus, a lapse in federal funds means research into traumatic brain injuries is on hold, and survivors worry the services they depend on may disappear.
These programs mean a lot to people like me, to the people behind me, and we need assistance past the initial injury.
We examine the issue that affects a growing number of Americans and follow the push on Capitol Hill to restore critical research funding.